Hi, and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. What I'm going to be talking about today is one of 3 videos designed to look at the impact of complex trauma. So this will be worthwhile for people with or without dissociation. The reason for doing this video is to look at some of the very common messages that are heard in the clinical room. So myself and associates within the CTAD Clinic, we often hear the same comments time after time from people with very similar backgrounds, and it doesn't seem coincidental that this will be the case. For example, a lot of people with complex post-traumatic stress say things like, "I can't cope a great deal." Now, it's obvious to us therapists that people are coping, but the belief is that people can't. So this comes with a sense of overall negativity towards the self. There's a lack of self-esteem, there's a lack of self-confidence, there's a lack of belief in the self. It's very clear where these have come from, and in our formulation we can see why people feel like this. These videos are designed to try and understand exactly what a person can work towards if they are hearing themselves saying these messages. The reason people say them is because it'll feel like things go wrong a lot of the time. Relationships, jobs, being in education, just daily activities, trying to go to the shop, trying to do simple things. Things seem to go wrong a lot. So people end up with these very negative messages. Stuff is going wrong, because therefore it must be me. I'm the reason why everything is going wrong. Therefore we have that lack of self-belief, confidence and self-esteem. This is very upsetting and undermining of the spirit for many people. And it makes complete sense as to why a person would think like this if everything does seem to go wrong in that person's life. Overall, what happens is a sense of failure. Not just that things fail, but that the person is a failure. And that's a belief. And that becomes very difficult to shift in clinical settings. And one of the hardest things that we can do as therapists is try and help people believe something different to what they are walking into therapy believing. As a way of being able to demonstrate a sense of direction for people with this kind of approach or this kind of belief is to look at the difference between people that are carrying trauma and people that are not carrying trauma. And a beautiful example of this, I heard at a conference many years ago, and it's stayed with me ever since, and is something that I talk to people in therapy about. And it usually raises an eyebrow, so I hope that this is of interest to you and that it's something that you might be able to use in your own life. And that's the difference between dandelions and orchids. Bear with me. Most people who have not got trauma would be considered to be dandelions. They cope everywhere. Nothing really seems to rattle them. Can put them in any environment, in any setting, they'll do fine. Just like the dandelion in the garden. It's almost like it doesn't matter what you do with it or where it ends up, it'll thrive. There will always be a dandelion in the garden. Too much sun, not enough sun. Too much rain, not enough rain. There they are. Year after year after year, the dandelions come back. So they're really hardy, and they can be lovely when they're bright yellow, and they are very beautiful plants. But they are, in essence, dandelions. And while that's fine, the dandelion doesn't really change a great deal. It either is or isn't a dandelion, and therefore it's the same thing. So people without trauma tend to get on their track and they do the things that they're going to do, and they stay doing those things, and it's fine. They're fine, They don't tend to change because they don't need to change. If you thrive in many places, you don't really learn a great deal about failure, therefore you just basically stay where you are. That's the message. Now, the orchid is a very different plant. The orchid is very delicate and very fragile. What that means is that in the wrong setting, in the wrong place, with the wrong amount of light, the wrong amount of rain, the wrong temperature, they wilt and they sag and they begin to fail. And you can see this is, if you've ever been given an orchid, looking after these things is incredibly difficult. So to look after one properly means to spend a lot of time and effort in understanding the right place to be. What an orchid needs then is the right resources, the right support, the right environment. And that's what non-trauma people don't really understand, because they're dandelions, they cope everywhere. Traumatized people are more like orchids. They need the right things in order to thrive. Take away those things in the wrong environment, the wrong setting, and they start wilting. And it happens very quickly, and you see this time and time again. It doesn't mean the orchid is a failure. It means the orchid is in the wrong place and has been given the wrong things that it needs to thrive. Therefore, to make the orchid flourish, there needs to be lots of careful adjustment, understanding exactly what is needed and provision of exactly what is needed. And this is something that traumatized people find very difficult, because the concept then becomes how to look after yourself, how to alert other people to what your needs are to meet those needs, and then how to meet those needs for yourself. This is an incredibly difficult balance to get right. And that's understood. The goal being that if you do get it right, then the orchid flowers. And when an orchid flowers, it is marvellous. It's absolutely a wonderful thing to see, and that's what we see as therapists in the clinical room when people get it. When they begin to change, they flourish and they become these orchids. And that's really why we do therapy, because to get that person to understand what they need, to help them meet those needs, and then to see them flourish. The key message then is for people with complex trauma is find your spot. Where do you need to be? What do you need to be doing, and what do you need to be getting in order to flourish? So my question for anybody watching this video then, to look at their own sense of self, it does not matter what the trauma is, if you are carrying complex trauma, is to say to yourself, what is my right spot? If you're able to answer that question and you can get those needs met, watch yourself flourish. Okay, I hope this has been an interesting video. Dandelions and orchids. It's a gardening metaphor. I think it's an extremely useful one. I hope you found this interesting, and as always, please leave comments in the end of the video, and like and subscribe if you would like to be given further content. In the meantime, and before parts 2 and part 3 come out, take great care.